Hey, welcome everybody. During the last week or so, I have seen every possible interpretation, explanation you can imagine about the current pandemic all over social media, with a lot of people quoting, a friend of a friend who read something on Facebook. So I've managed to nab one of the leading experts on infectious disease available in the world today. Dr. Jan Bonhoeffer is a professor of pediatrics and infectious disease at the University Hospital in Basel. He headed a global vaccine safety organization called the Brighton Collaboration. He's worked as a consultant with the World Health Organization and the Centers for Disease Control. He's an internationally renowned infectious disease specialist with dozens of papers to his name, as well as a pediatric physician in practice, working with people every day. So welcome, Jan.
Thank you, Arjuna.
Thank you so much. I wanted to ask you a few of the questions that have been floating around Facebook from an expert, so we can get a little bit of light shed on some common on-the-street myths, if that's okay with you.
Let me try.
Okay, good. So the first is one thing people are confused about is the possibility of reinfection, right? So many people are saying, well, if I get the disease, am I then safe? Once I get the disease, is it okay for me to go anywhere because I won't get it again? And is it also safe to say that I won't infect anybody else because now I've had the disease already? What's the answer to that?
Well, from all we know today is that there are cases reported about reinfection, and that there are some animal models, for example, in ferrets. And so there's some ideas, some attempts to figure this out. At the moment, there's no real evidence that reinfection is really a systematic issue. So at this point, current state of ignorance is I wouldn't consider reinfection something to worry about for most people.
Cool. Thank you for that. So another question a lot of people have has to do with the severity of symptoms, right? So what we're hearing is that for most healthy people, that infection with this disease produces mild symptoms, or it's possibly even asymptomatic, right? So you get it and you don't even know you've got it. And it's the common understanding is that only people with a weakened immunity or people who are very old who would experience more serious symptoms and risk death. Is that information actually correct, or are there enough anomalies to make that incorrect?
Well, there are certainly people who are young and fit and well, as by all standards that we would like to apply today. And they are seriously affected, and some even die, but it's clearly a rare event in those, and it's clearly way more common in those who have risk factors as you describe. However, the actual numbers of this, I believe we will get in, 1, 2, 3 years from now, as this is all worked up. Right now, there's a quite serious bias in how these data are being assessed, and we particularly look into these groups. So the ones who are being tested are those who are ill or have the risk factors. So we're not testing everybody in the whole population. So the risk distribution right now, I wouldn't give too much weight to this until we've seen the full data. What we're missing is how many of those that are well and asymptomatic are infected, and that will kind of rebalance. But as of today, yes, those that have risk factors are more likely to have serious disease or die.
Excellent. So do you have any sense yet? Well, actually, let me go back to something you said already. You said these statistics are getting skewed or biased. Who should we point the finger at about skewing and biasing? Who is motivated to give us skewed information?
Well, if you point with your finger at somebody, 3 point at you, right? So,
right. Okay.
So getting this right is probably one of the most difficult things. And clearly the situation has shown that our healthcare system is not ready yet for handling, the global public health system isn't ready to really handle the situation in the way that we would like it to see handled. So many places, many local places, many international organizations are trying to get this right, to collect the right data, but this is very difficult. So we will have to wait again for a year or two until we have better data coming in. Right now, what we see is that we have case definitions developed in who has the disease, and we have case definitions for who should be tested. And who should be tested are really the ones with symptoms and risk factors. So we don't test everybody who could possibly be a case. So we're missing a lot of cases. We don't test those who might have no signs and symptoms. So that means the population that is being looked at is the one that is already at risk. Okay? So in that way, we don't get population data that is unbiased, but we're actually looking at a specific group. That makes sense from the lab capacity point of view. For example, if we were to test everybody, then we might not have the capacity in the labs to test those who really need the evidence today. So from a patient management perspective, it kind of makes sense to have these case definitions. From an epidemiological point of view, it would have been nice to see the entire population tested. But that, of course, is a challenge to get a virus and within a few months or weeks be ready to test everybody on the planet. And have all these lab facilities there. So it's quite astonishing how many labs do have the capacity, and that's the quality of data that we have to live with at the moment.
You know, there are, I don't know if obviously everybody has a different experience of Facebook. You know, no two people have the same Facebook because you've got a different population. But what I'm seeing, not only on Facebook, but also even among mainstream news, is there is a dispute in the air about whether this was a natural mutation from an animal virus, or whether this could possibly have been man-made or human-made in a lab. What is your comment about that?
Well, truth will reveal itself. Time is always a good factor in this. We don't know it. I'm not a friend of conspiracy theories. So I would like to just wait. I think for everybody now being either fearful of being infected or concerned, or for all those who are infected right now, it doesn't really make a difference where that bug came from and how exactly it occurred. I would say at least it is way more likely that this is a virus that has emerged like so many other viruses, and it is a natural evolution, and now we're giving it a lot of attention. Right now, I'm more concerned about why do we give this virus with these properties so much attention, while similar viruses with similar properties have not received quite as much attention. So that's an interesting phenomenon. So there's a real pandemic happening, that's no question, there's no doubt about that. But on the other hand, there's also an epidemic or a pandemic of fear occurring. So there's an interaction between the population and the actual pandemic. So there's the actual pandemic and the perception of the danger of the pandemic. And I guess in a year or two, we will learn more about how much, what that weighting is actually going to be.
Just briefly, I know we need to keep these answers very short, but briefly, what would be your hunch about why this is getting such enormous attention, whereas there are other viruses that don't get quite such an attention? And we've seen, although people are dying from this, it's disputable how much the overall death rate for the whole world has really gone up. So we're seeing people die from this cause, but apparently less people die from this than were dying from automobile accidents before we couldn't drive our cars anymore. So why do you think this is getting so much attention?
I think there's two factors. One is that the information that was available initially was truly very concerning. This has changed over time. So initially, I believe it was very understandable that this has received so much attention. Now, I'm not sure whether we should still kind of follow that same level of concern. If we look at it through a public health perspective, as you have asked, from a global mortality perspective, for example. The concern was never so much about the severity of the disease. The concern was more about the number of cases occurring at the same time. And this is one of the main differences to, let's say, influenza, for example, one of the comparisons made so often. So influenza does have a much higher death toll in terms of numbers, but cases occur more spread over time. And so this was the main concern. And the concern was more about, if you like, the healthcare system rather than the bug itself. So is the healthcare system ready to handle a pandemic like this? Is it ready to do that? And we see that in different countries, we get very different outcomes. So the pandemic now, I would say, is not so much a question of how dangerous is this virus, but actually how apt and what is the current capacity in our healthcare system to handle situations like this.
Now, you've spent a good part of your professional career, I think about 20 years in vaccine safety, right? I read yesterday that Johnson & Johnson has actually now, they are in trial with a vaccine. They've developed a vaccine. They've put it in trial, I think, in the state of Michigan with 3,000 cases. But you know about vaccine safety. What might be the downside of rushing a vaccine too quickly?
Okay, so this is part of a general trend, and J&J is certainly one, but then there's other candidates. There's a series of candidates right now in the pipeline. Many of them are moving into a trial stage now, at different levels, and there is definitely an abbreviated licensing procedure now. So these will be developed under emergency conditions and licensed possibly under emergency conditions for emergency use. And that means there was not the usual kind of safety testing as we have, as we would like to see it for the usual vaccine development at quiet times. So yes, there is a higher risk of safety. That means particularly the rare adverse events, there will not be the data available at the time of launching. So it might be a similar situation to what we've seen with Ebola and some other vaccines, where they were developed very quickly and then moved for distribution very quickly. And then as they are rolled out, the actual rollout and distribution dissemination is accompanied by a very, very high degree of vaccine safety surveillance. So there will be trials running at a much higher level than at a rate of observation, if you like, than usually. So yes, the first ones to receive will be at a higher risk as compared to normal, and that has to be balanced against the actual risk of the disease and the pandemic that we're observing. So basically, in a nutshell, if a vaccine is being rolled out for coronavirus, that means we're ready to accept a higher risk of safety, given that we have a very high risk of the disease.
What would be the difference between somebody getting this disease, maybe they have whatever degree of severity of symptoms, maybe mild, maybe not, they get the disease, they develop the antibodies, and then they're on the other side of that, versus getting a vaccine? How would those two people fare in comparison to each other, say 6 months later? One had the disease, one got the vaccine.
We will only be able to tell then and thereafter. We will have to see, because we don't know what candidate will make it to dissemination or to the market, and which ones won't. So we will need to, that depends on the vaccine. Generally, you're asking the question, is there a difference between vaccine immunity, vaccine-acquired immunity, and wild-type virus acquired immunity? For viruses, typically, there isn't such a big difference. So I would assume that if a vaccine is out, it will be effective. There might be some questions on the rare side effects or on the rare adverse events following immunization. In terms of immunity, I would expect a similar profile, at least for the first dose, and then how many boosters are needed. All these questions, time will tell. Nobody knows so far.
Well, that leads us to perhaps the most controversial question, which I'm just going to get a short answer on from you. I know a lot of people in the, fairly credible people in the alternative health world. And the alternative health world, which includes, Chinese medicine, naturopathy, etc. The alternative health world tends to look at improving your overall health systematically over time rather than treating disease. So within that world, a lot of people state the view, I would rather get this disease as soon as possible. I have all faith in my immune system because I've been boosting it over years with careful immune boosting protocols, herbal and otherwise. I'd like to get this disease, get it over with, develop the antibodies. Of course, I would isolate while I've got it, and then I would know that I'm immune to it and I can't pass it on. Now, that view creates a tremendous backlash. If you whisper that view, people see that as the most wildly irresponsible thing in the world. what would you say? Because very credible people say, I would like to get this. I'll isolate while I've got it, but I'd like to get it. What do you say to people who state that view?
Okay, you're asking for a short answer to a really complex question.
Okay.
So there's different things. So you might get a backlash for this question for many reasons. One is that a lot of people are in fear right now, so they're responding to this kind of suggestion from a point of fear. The other is people have actually made personal experiences and have met people who had serious illness or actually died. And so asking this question to somebody with this experience, this is calling for a lot. I would say there's two aspects for this that make sense. One is I tell my kids don't play with fire. Okay, so to suggest why don't you go out there and get the disease, I think that's kind of a step too far. Although when you look at it from a mathematical point of view and you're balancing your odds and you're saying, it's actually quite likely that I'm having a mild or moderate illness rather than being actually affected seriously, you could kind of play the math game, but there's a certain degree of poker with it that I wouldn't feel comfortable to recommend. Yet the other point is, does it make sense to support your immune system? Does it make sense to actually strengthen your health and wellness in view of a clearly present illness? Yes, absolutely, it does. And the reason why I think this is not so much stressed in conventional medicine is that this is a weak spot in medicine. And so the vaccines is one of the methods that is available to conventional medicine, Western medicine, to prevent illness. And there are not so many other things available. It's not one of the strengths. The conventional medicine tends to kind of want to fight disease. That's where you can produce, a molecule or something that can be patented and money can be made with it. So there's way more emphasis in this direction. Quite often the preventive health measures are nutritional, behavioral, all the good things. And they totally make sense, but they are not emphasized as much. They're kind of recommended as, can do, but they're not, I think, appreciated to the degree that they should. And I hope that there's more research, and some of the data from the coronavirus pandemic might actually support this notion, and we may actually get data to show how the different types of populations actually fared during this last pandemic. And that might highlight the point that you're making, that it makes sense to support our immune system and our wellness in defense of infectious diseases.
Great answer. Thank you. So in other words, don't play with fire, but have a fire extinguisher ready anyway, right?
Learn how to use it with the barbecue.
Yeah. So my last question today, and thank you for your time. My last question is, it's hard to believe, but back in January, not that long ago, we were going to concerts, we were hugging, we were dancing, we were going to restaurants, we were doing everything. We were kissing people. That seems so long ago. It seems like like a fantasy dream right now. But so my last question is, we're all patiently waiting this out and learning how to be happy at home. But reasonably, how long can we expect that there will be restrictions on our behavior before we can dance and hug and kiss and share meals together again?
Well, it depends on where you are on the planet and where what the dissemination and transmission pattern is. In Switzerland, they have just announced today, a few hours ago, that end of month, some of the activities will be reopened. Certainly bars and restaurants will be probably last. I guess overall, if we look at it from a global perspective, this will be with us for a year or more. I have no idea when they will start intercontinental flights again, for example. Right now, it doesn't look like this is happening very soon. So different, countries will have their different paces in reopening kindergartens, reopening daycare, reopening the medical system to regular business. So gradually, there will be an incremental reopening of different services. Parties and dancings, big gatherings, it's very hard to tell. Much of this is more of a political than an epidemiological discussion, as far as I'm concerned. I would believe we're looking at least the second half of this year.
Hey, Jan, Dr. Bonhoeffer, thank you so much for your time today. I really appreciate you answering these questions. I think it's very, very helpful for all of us to get some calm scientific sanity shed on our fears and fantasies.
Thank you, and I'm looking forward to the comments. If people have comments, I'm happy to learn. Things evolve so quickly there. Yeah, thank you.
Thanks.